is my great privilege to introduce to you our keynote speaker, Robert Ross. Dr. Ross is President and Chief Executive Officer for the California Endowment, a health foundation established in 1996 to address the health needs of California. Prior to his appointment in September 2000, Dr. Ross served as Director of the Health and Human Services Agency for the County of San Diego and Commissioner of Public Health for the City of Philadelphia. He has an extensive background as a clinician and public health administrator. His service includes a wide range of health activities, including San Diego State University's School of Public Health, the Children's Health Hospital of Philadelphia, and the school-based clinic program in New Jersey. He's been actively involved in the community as well as a professional for many, many years at both the local and at the national level. And he's served as a member of the National Vaccine Advisory Committee and on boards of the National Marrow Donor Program in the San Diego United Way. He has received many honors and distinctions over the years, including the Council on Foundations 2008 Distinguished Grantmaker of the Year Award. During his tenure as CEO of the California Endowment, the foundation has focused on the health needs of underserved Californians by championing the cause of health coverage for all children, strengthening the capacity of the community health centers in our state, and improving health services for farm workers and ex-offender populations. He has been a champion in many respects for the underserved, for the health needs of all of us, for the community. It's my great pleasure to introduce to you Dr. Robert Ross.
Good morning. Thank you, Jack. Good afternoon to all. Jack, you look pretty good for 80 years old. Amazing, in fact. Congratulations to all of you that have your fingerprints on the legacy of this phenomenal institution. And don't celebrate too long, because I've got more work for you to do to help us fix Los Angeles and the state. This is a pretty amazing time. I was honored to give the annual Martin Luther King Breakfast keynote speech this morning, sponsored by the YMCA. And during that speech, in honor of Dr. Martin Luther King, I did a bit of a role play, imagining that Dr. King would come down and engage us in conversation for a few minutes. And I won't go into any detail about how that played out, but I'll give you the Cliff Notes version, which is Dr. King is informed that in a couple of days an African American is going to be sworn in as President of the United States. And he registers his both surprise and awe and glee with that news. And then he goes on to ask about, what about the issues that I fought for and died for, on poverty and healthcare and public education and affordable housing and social justice, and how are we doing on those things? And that report that was given to Dr. Martin Luther King was not as rosy. And what Dr. Martin Luther King might say, that's all speculative, of course, but I'll give you the punchline of the address, which was a quote from Dr. Martin Luther King, one of his actually lesser-known quotes, which was, "We may have sailed here in many different ships, but we're all in the same boat now." And that's I think the crisis that we're facing today, that our new president is facing, I think affords us an opportunity to really advance on what the theme of this particular conference has been, which is about building bridges. We certainly are in the same boat now. The boat is not doing particularly well. And I think if the election of this president taught us anything, is that a strategic, disciplined, multicultural, multi-ethnic, multi-generational, multiracial coalition can get a lot of things done. He ran a campaign that left even veteran political strategists completely in awe of what he did. And I think it's a lesson for us there that if we want to get things done, we better think about doing a better job of building bridges and getting out of our silos. So with that as the backdrop, condolences, never mind the economy, condolences on Mark Sanchez leaving for the NFL. That's the big, terrible news of the day at USC's campus. Try and shake that off, we'll move on. What I was asked to do was, our foundation was created in 1996 out of the Blue Cross of California nonprofit to for-profit conversion. A bunch of those dollars were dumped into a new foundation with a new board of directors that became known as the California Endowment, with a mission to improve the health of underserved communities and populations. So we are in our, I guess, 12th year or so as a foundation. I've been there for going on 8. We just finished a strategic planning process. The world turned upside down in between the time we started and the time we ended. But I wanted to share with you a summary of that process and how what we've learned over our 12 years of foundation is informing our work. And I think it'll lift up some of these themes that you've heard about today. I'll try and leave some time for questions and some comments as we struggle with the challenges of trying to build bridges, even the opportunity of building bridges and getting out of our silos and building coalitions to advance opportunity in this country, and in particular here in Los Angeles and in California. Our foundation, and the frame here, I was interested in because we were in strategic planning as I was watching the election campaign unfold. So I would be in strategic planning meetings and I'd turn on television and I'd watch the themes of the election campaign. And I was struck by this, there's a lot of talk, particularly from the Barack Obama campaign, about these concepts of hope and change. And they're very lofty words, they're wonderful words that hopefully stir men and women's souls. But really the work that we do, the business that we're in, is in the transformation from hope to change. Okay, in very real ways, and I'll get to that in a second, and it sort of became kind of a secondary theme of our own planning. So I'll give you the punchline first. What did we learn in those first 10 years of foundation? Those 10 years involved $1.7 billion in grants to 7,000 different grants made across the state, to 3,000 different organizations, most of them of the nonprofit variety. And what we do is a real hard look in the mirror at what we achieved with those dollars, what we failed to achieve with those dollars, and how we could get more impactful. And we decided to reach out to community leaders, to civic leaders, to grantees, our own board of directors, our own staff. What do we need to do in the next 10 years to have more lasting and sustainable impact? And the bottom line was to be focused and be more strategic, no surprise there. But these were the 4 elements that when we looked at meaningful successes of the kind that, maybe not popping a champagne cork, but one that we could feel good and proud about. These were the 4 elements that were in play, generally, en route to that success. That there was a community-generated idea for improving the health of a community or a population. That idea was supported by evaluation, data, and research. That we had a good idea that had media that was data-driven and data-supported, but that you had to do the other 2 things equally well, which was to build an advocacy advocacy strategy, and a media strategy, and a political strategy to move that idea forward. And that's sort of, we decided to build the next 10 years and really wrap it around those lessons. And I want to take a moment to explode one myth. A lot of myths about philanthropy, but this is actually one of my favorite ones to explode. You'll hear a lot about the lack of innovation and the need for social innovation. It's a very interesting phenomenon when you watch some of the corporate folks that have now permeated social entrepreneurship in the world of philanthropy, and I think they're giving us a new edge. A lot of them have come from the internet world. There's Gates and eBay and Google, and they're sort of beginning to reinvent notions of philanthropy. And I think their focus on results and innovation is important. But they bring, I think they kind of carry with them a myth that I've seen the Gates Foundation begin to realize that, well, wait a minute, maybe it isn't just as simple as finding an innovation. Because in the private sector, you got to find the next killer app, right? And when you find a breakthrough technology innovation, it can, if it's effective and it moves fast, and it makes a lot of money fast, right? In our business, it's not finding an innovation that's the problem or the challenge. Okay? The problem is when we find one that actually works, we don't know how to scale it. Okay? I'm not saying there's not a need for newer ideas and innovation, but I'm going to run through, in fact, data and evidence about innovation that's already out there, new practices that are already out there, that have data to support that they work. But we can't, and have a lot of difficulty finding ways to take that innovation and build it into meaningful and sustainable systems change, policy change, and so that public dollars are actually being spent in a different, more effective way. And so this strategic plan we developed and the restructuring we're going through right now is reflective of those lessons. So how do you make the pathway from despair and hopelessness to hope and change? I'm going to move quickly through this. This was actually part of my presentation for the MLK Day, but you got to understand, this is driven not only by evidence and experience, but a set of values and a set of belief systems. And it is why I can feel optimistic in a pretty doomy and gloomy environment. And this is, the American story is basically one that is summarized by moving from hopelessness and despair, taking risk, and moving on through to change and opportunity. And pretty much every American can kind of look back and reach somewhere in their lineage, somewhere in their ancestry, where someone in the family took the risk, took the shot, had a vision for creating a future for his or her family that was better than the reality that they were dealing with. And it doesn't matter whether you're a first-generation American or an eighth-generation American, somewhere in there, that's kind of the shared American story, is it not? There are members in this audience whose families came through and weathered either the Trail of Tears, or the Irish potato famine, or the Dust Bowl, or came through Angel Island, or came through in the bottom of a slave ship, or Ellis Island, or perhaps even crossed the border to seek opportunity, right? And that's in part what Barack Obama tapped into to get elected, that there was a shared American story, and that the politics of divisiveness, of me first, of either left and right, or racial and ethnic divisiveness, and that's a bygone era. That there is a shared American story, and if we could reach back and tap into that, can we reinvent America in a way that is grounded on the values that form this country? And each one of you sitting here can think back, maybe it's a generation, maybe it's 5 generations, but somebody in your lineage, in your ancestry, took the risk, weathered one of these storms, so that you could be sitting here eating salmon and salad in a nice suit, in a really nice building, and go home to a decent home. Somebody took that risk, so you could be here doing that. And so you got to believe that that still exists in our communities, that sense of moving from despair and hopelessness to real change and opportunity is there. If you don't believe it's there, then we might as well give up. And my fear, at least with my generation, those of us in the room that are maybe between the ages of 45 and 65, we are now facing a very stark possibility of raising the first generation of American children that will not do as well as the generation that came before them. And at least as it relates to my generation, that's happening on my watch, on our watch. And the moment we have in front of us is sort of the fork in the road. We're going to make this thing work, or we're not going to make it work. I have a bunch of slides here about how bad things are. I'm gonna it's supposed to be inspirational, right? Not depressing, but it's, you know, it's about poverty and health and disparities and incarceration rates and some high school graduation rate numbers, and you see those. None of those are a surprise to people in this audience. The fundamental and operative question here is, you know, so what are we going to do about it, right? So let me focus on that. So let me shift now to what our experience has been with some of the giants in California, not people named, you know, Chavez or King or Obama, but community leaders that are innovating and restoring a sense of opportunity in their communities. Second Chance is a program in Southeast San Diego. It's a very interesting program. It's run by a hyperkinetic, frenetic Jewish guy named Scott Silverman, former alcoholic and drug addict. And he runs a program that helps to reintegrate ex-felons fresh out of prison and back into their communities. Okay? So it's like Scott, and then his entire staff is like ex-gangbangers and felons. Big, beefy guys with tattoos, and it's just kind of funny watching Scott work with these people. And we funded the 3-year evaluation of their success of their model. And it's interesting because that doesn't sound like a health program, right? We've kind of broadened our view of health, but as you know, many of these distressed communities, if you do not deal with this issue of incarceration and reintegrating incarcerated young men and women back to those families, these are the children of, parents of, they're the community residents. They can either destroy interior community down or they can build it up. So that's a health issue for us. The data showed that Scott and his team have engineered about a 78% success rate, 3-year success rate in getting ex-felons and getting them into jobs. Okay? Now that is the utter opposite of what the state of California's experience is. Okay? The state of California's experience is the other way around. Okay? 80% fail after 3 years. And what they've done, really, basically, they created a model that none of sort of what they were doing was really new. The model is that the drug and alcohol and treatment and support services, the housing piece, the training piece, the job placement piece, that they're all integrated. And these inmates, when they come out of prison, are actually surrounded by these services and supports. And the staff are not people with MPHs and PhDs. The staff are former gangbangers and ex-felons who have successfully reintegrated themselves. Right. And I'll just divert for a second to share with you one vignette. When I went to visit, I spent the day at Second Chance. I wanted to see what they were doing to get these kind of results. And the first class of the day I went, they had a relatively new cohort that was of several dozen of these ex-felons that were coming through. And the name of the class was Handshake 101. feeling was they realized that for these ex-felons that have grown up in communities like Pacoima and South Los Angeles and East LA and Southeast San Diego that have been gangbangers themselves, maybe they were Crips, maybe they were Bloods, maybe they were other gang members. The most important, simple first skill that you need in getting a job is a handshake, eye contact, and a smile. I mean, when you meet a prospective employer, that's something we take for granted, right? Handshake, eye contact, and a smile. Well, they don't have this behavior. To the extent that they may have had it, it's been unlearned. Because if you walk around San Quentin prison with a handshake, eye contact, and a smile, that's actually dangerous behavior. Is it not? Right? So they spend a couple of hours practicing the art of a handshake, and eye contact, and a smile. And they offer tattoo removal and other kinds of things. And it's a funny thing, you listen to Scott, and they'll say, I don't care, a lot of you guys have bad teeth because they've never been to a dentist, right? So I don't care, you only got one tooth in your mouth, I want to see it when you smile. Right? So that's our experience with Second Chance. I'll move quickly through some of the others. Youth Uprising, a phenomenal community leader in East Oakland named Olive Simmons, an African-American woman who developed a youth center in a pretty distressed, gang-infiltrated neighborhood of East Oakland. And she helped, along with the county, acquire a piece of property. They got a little money from the county. They raised some private dollars. But she brought the youth in from the community to help design the center. And now it's a state-of-the-art youth center that's giving kids all kinds of job training, internet support, and actually giving disaffected youth a place to go that's safe in that community and actually changing real lives. Latino Health Access is a wonderful organization in Santa Ana, led by the irrepressible America Bracho, a woman who has helped a community of mostly immigrant Latinos transform an unhealthy place into a healthy place, a place that has fresh fruits and vegetables access and exercise opportunities for the kids, making certain that domestic violence issues are being dealt with. And she's just another terrific leader. Homeboy Industries, most of you know about, East LA here, Father Greg Boyle. The Harlem Children's Zone is not a grantee of ours, but is a phenomenal program in Harlem that's demonstrating that you can turn lives around for children and families in a 20-block square radius of Harlem. And they served as an inspiration for a portion of our strategic plan. Pizzazz is another great story. This is a program, an after-school program in Southeast San Diego, started by an African-American couple who retired, not wealthy, middle-class African-American couple. They were deeply concerned about lack of opportunities for kids to do anything after school, and they investigated there was a business in the community that went out of business, an old Kentucky Fried Chicken that went out of business. It was boarded up. It was a place for graffiti in the community. They decided to purchase that property. They cashed in their retirement savings and started this after-school program for kids, refurbished the facility, painted it purple, and it's called Pizzazz. They're on Euclid and Imperial in Southeast San Diego. The Santa Clara County Children's Health Initiative, about 5 or 6 years ago, had a vision that every child in their community, working through public-private partnerships and crossing boundaries, every child in that community, regardless of immigration status, could have access to health care and health insurance coverage, and they've done that. We've now funded the replication for 18 more of those models, and is now serving as a national model. So I could go on and on with these, but what we did was we developed a strategy that was gleaned from what we learned from these communities. We also, at the same time, we're learning about how to drive and move a policy agenda. Many more failures than successes. But what we wanted to do was to lift up those innovations, those promising practices that were being developed on the ground in some of those distressed and needy communities in the state, and create a pipeline or a superhighway from what they're doing to Sacramento and to Washington. Okay, in a sense, that's what we're trying to achieve. Okay? And the 4 Ps that anchor our strategic approach is that we're going to focus on community 4 Ps, which is a commitment to prevention, focusing on communities in poverty, selecting a limited number of places, and I'll say a little more about that in a second, and connecting the work and experience and the successes on the ground to a policy and systems change strategy. We now have a 10-year measures that define success. What does the flag on the hill look like for us? This was a big change for us 10 years ago. We defined success as making grants. Now we define success as making change. And we now have a set of outcomes, both in the places and communities that we're going to select, and I'll get to that in a second, as well as the policy outcomes. And actually the two drive and support one another. The work on the ground informs the policy agenda, moving the policy agenda forward in terms of having the right kind of policy environments that underserved communities can become healthier, creates and nurtures the right kind of outcomes in communities. Okay, so you see sort of the mutual interdependence of the two. We've selected a limited number of communities for long-term 10-year place-based investments. The communities are Boyle Heights and South River Corridor, Vermont, Manchester here in LA. And you see some of the other communities around the state of California. A few rural sites thrown in, East Salinas and Coachella and Merced and Arvin-Lamont. We wanted the diversity of California represented in this building healthy communities prevention strategy. Before I get to these outcomes, let me talk about place for a moment. We're focusing on place for two reasons. The first is the data and research that tell us about health disparities and improving health outcomes in general, but specifically for underserved populations. If you look at the healthcare reform debate in this country is about insurance, largely. It's largely about insurance, it's largely about costs. It's about insurance coverage. Okay? It's important that the debate focus on that issue. What gets ignored or relegated to the back burner or sometimes is rarely discussed, although the Barack Obama administration has been talking about it, is the important role that prevention and the built environment and community plays in health and health status. 80% of what influences your life expectancy and your health status has nothing to do with doctors and hospitals and health insurance. I know that's, at first blush that sounds like, wait a minute, that can't be. It's true. If you just think about your own health life, now some of you may have a chronic disease, maybe you've been treated for cancer, you go to the doctor a lot. Most of you go to the doctor once a year, maybe twice if you're lucky. You're in there for 45 minutes, if you're lucky, and you're out, right? The rest of the time, your health is largely influenced by, do you smoke? Do you drink? How much do you drink? Do you wear your seatbelt? How do you drive? What's the neighborhood look like that you live in? Are there drive-by shootings? Are there places where you can get access to fresh fruits and vegetables? Are there places to exercise? What about mental health? I mean, those are the really significant factors that influence health, particularly in underserved and impoverished communities. Okay? And so the trick was, how do we get at that other 80% when there are very complicated, thorny, sticky, messy issues? Health insurance is the easy part. Right? But even if you gave every poor American or Californian a health insurance card tomorrow, so that you had 100% access to health insurance, that doesn't necessarily translate into the reduction of health disparities in communities of color and underserved populations, because you got all the other messy, sticky stuff to deal with. Okay? So place matters in health. The second thing is that if you want to drive change, sometimes you need a really good story to tell. And my experience, even before I got to the foundation, and particularly since getting to the foundation, if you want to grab the heart and mind of an elected official, no numbers without stories and no stories without numbers. You got to have a powerful story to tell, and you got to have data and evidence to back up that this is a smarter, more effective way of doing business. When you have the two in combination, it tends to work a whole lot better than either. Okay? And when you focus on place, you allow for a better opportunity for transformational change to happen, even if it's not at scale. And if you look at the success of Jeff Canada Harlem Children's Zone, Harlem Children's Zone is now being sort of looked at as a national model, and the Barack Obama administration discovered a Harlem Children's Zone that's actually thinking about some of their urban policy strategies based on. That's because Jeff Canada took 14 years to focus on a 20 square block radius in Harlem. And said every one of these kids is going to not get shot, is going to have a shot and an opportunity moving forward. Okay? And so the power of that story, and then Jeff got discovered by Oprah. And when that happens, right, everything takes off. So Place affords us two things. One, it provides us with a targeted, focused opportunity to really transform, not just fund, but transform with community leaders, a distressed community into a healthy place, the capacity and ability to generate powerful stories, the data to support that those stories are meaningful in terms of policy change. And then you've got to link that place strategy to the policy strategy, which is the real trick that we're struggling with. We do have, in these places, we have key outcomes. They're listed up there. I won't bore you with them, but there are things like, it's kids, building a healthy community is a place where kids are healthy, safe, and ready to learn. These are the 4 key metrics that we're focusing on: child obesity reduction, youth violence, school attendance and absenteeism, and health coverage. So you see health coverage is necessary, but insufficient. We've got policy outcomes which focus on prevention. We work on the key systems and advancing prevention through those key systems, and you see the healthcare system is only one of the 4. We're a health foundation, but we're looking for prevention impacts in those 4 systems. Why? Because you've got to surround these kids and young people with no opportunity to fail. Right? And the systems that they run across are their home, their community, their school, and if they're really high-risk and at-risk kids, the foster care and criminal justice, the juvenile justice system. So you've got sort of prevention policy goals in each of those and the built environment. Okay? So you begin to see pretty quickly the opportunities for entities like housing, urban planners, healthcare providers, school officials, law enforcement officials needing to come together to drive this vision, and we're prepared to fund and support the glue money that needs to happen to move that forward. We're now going through an organizational restructuring to set this up. What's interesting is that we're now restructuring into a places group. Those are my staff. They're going to be accountable for and responsible for working with those community leaders in those 14 places to build and strengthen a healthy community. And I've got a policy group, and those are the ones that are going to be tasked with moving the policy agenda in Sacramento, in Washington, driven and supported by what we're seeing that happens on the ground. So it's kind of it's a different model for us, but we think that's the model with the clear lines of accountability between what we're trying to achieve and what we've got structurally. In terms of strengthening our policy presence, one of the things we've done a lot of policy advocacy work. As folks from USC know, we just stole one of the governor's top public policy folks in health, Daniel Zingali, who's been a major advisor to the governor on health reform and policy issues, and he's going to be our senior vice president for public policy and systems change. We're looking at strengthening our work on the ground as well, and how do you connect A to B. And the last point here is that the framework for us is chutes and ladders. Now, many of you played the game Chutes and Ladders when you were kids, right? And many of you are actually, the game's still out there. My 6-year-old plays it, so our daughters and granddaughters are playing. When we started moving more into policy work, not just funding projects on the ground, but the policy and advocacy work as well, based on the experience that we had in child obesity prevention, in children's health coverage, working with community clinics and some of the policy work we had done. You've got to be okay with, and I'm reminded by on this day, celebrating Martin Luther King's birthday, Martin Luther King's comment, and I'm paraphrasing, something like, the arc of social justice is long, but it bends towards righteousness, right? Well, the righteousness part, it's the long part that's frustrating, right? And we decided to, for our program staff, to develop a training model that would help them understand the importance of policy and policy work and policy advocacy. And we actually developed, rather than trying to just send them through boring training sessions, we actually developed a game. And the game was based on the Chutes and Ladders format. Okay? Remember the Chutes and Ladders game? You kind of roll the dice and enter the space. And then there's chutes and there's ladders, right? You hit a ladder and you can go up, and you hit a chute and you go fall back down. Well, that's what this work is about. The work of public policy is a game of chutes and ladders. There are opportunities and there are roadblocks. You can be strategically brilliant, make the best grant, make the best partnerships, have the great strategy, and then all of a sudden, wow, a recession hits. Or all of a sudden, the Congress changed. All of a sudden, your champion in the legislature or your champion in the mayor's office that was helping move that issue leaves. Or the opposite can happen, right? So you just kind of have to be okay that social justice and social change work is by definition uphill. It's not supposed to be easy. And so this is why we asked the board to commit to a 10-year investment strategy. And it's actually not the amount of money, it's patient money. Patient money. So that's sort of the summary of what we're doing, why we're doing, and where we're going. Focusing on prevention, kids healthy, safe, and ready to learn. Focusing on some of the most difficult neighborhoods in the state. Depending on the optimism of local leaders and public-private partnerships. You can see how it's going to be so important for us to get out of our silo, which we've tried to do in health, and bring folks around a common and shared vision and common agenda. And if we can do this 1/10 as well as Barack Obama engineered his election into the presidency, we'll do just fine. Thank you. I'm told by Jack we've got to be out of here at 2, so you have like 11 minutes for comments, questions, concerns. Bob.
Thank you for a fascinating presentation. In my experience, one of the realities of programs that work is very special qualities of the particular leader. You've identified some in your talk. Have you thought about how we reproduce that capability?
Oh, that's a softball question. Let me tell you something. Bob has just hit one of the real conundrums for those of us that are in the business of social investing. Is it the leader or is it the model? And I will say to you, Bob, we've kind of given up on trying to answer that question. So what we say is, I didn't talk much about community capacity building and leadership building in the presentation. Trust me, those investment dollars are in those communities. There are organizations, and I'll pick out one just as an example. In fact, one of their leaders was here today. Karen Bass was, I don't know if she was the founder, but certainly she was the longtime director. She was the founder of the Community Coalition, which has been a great, and when I came in, Karen was the executive director. They were getting significant resources for us in terms of grant funding. Other foundations had gone on to support them. And then Karen decided to run for office. Which was, the first reaction was, wow, isn't that great? Karen's running for office. And the second reaction was, oh shit, Karen's running for office. What's going to happen to the community coalition? Right? And so, now the end of the story is a pretty darn good story, is that Karen had paid attention and heed to a succession strategy within her organization. The board was pretty strong. And the successor in waiting was Marquise Harris Dawson. And a number of foundations were kind of like us, so, oh my God, what's going to happen with Community Coalition? And Community Coalition hasn't skipped a beat. Okay? And Karen was a terrific leader, and Marquise is doing well. So rather than trying to sort of answer that question, is it the leader or the organization, let's just assume that all organizations with great leaders need organizational capacity building, board development, succession planning, and can we give them sort of that's some of the patient money, right? And so we're beginning to get better at engaging those kind of leaders in conversations about succession and succession management? It's a great question, because right now you're seeing a particular generation of nonprofit leaders that have been effective, that were the founders, came in the 70s, have been 20, 25, 30 years in, and are now getting ready to leave. And there's a real concern about the loss of momentum in the nonprofit sector. Others? I pounded them into submission, Jack. And I have a 30 seconds for a request when I'm done. Yes?
I've always been frustrated that really great programs don't get replicated, to your point.
No.
Is any progress being made? Is there just a magic about it? Is it leadership that you can't take from one community into another? Is any progress being made on the process of replicating outstanding, innovative, breakthrough programs?
Yeah, this is the second softball question. You guys are hitting on the right questions. Let me go back to the Harlem Children's Zone for a moment, okay? Just as a case in point, as a concrete illustration. The Harlem Children's Zone and many other programs like that, and I'm going to use also Father Greg with Homeboy Industries in East LA. There are actually two replication questions. One is sort of a replication question, one the other is actually an implication question. The replication question is actually the model itself, structurally, right, and what works. And it is hoped that when we spend money with Cal State Northridge or USC or someone else to do an evaluation, that they're not just evaluating the leader, but the model, right? And does the model work, and what are the implications for others in terms of spreading the model? The other replication issue has to do with actually what are the policy implications of what succeeds. And Jeff Canada, he and I have become pretty good friends since I noticed what he's been doing. The conversation we had kind of went something like this. Jeff, this is great. Must be great having governors and senators and mayors call you about, what to do. And he said, it's kind of funny. They come here and they visit, and then they say to me, well, what do we do now? And then his answer is, I don't know, you're the governor. I thought you knew. Meaning, sort of, what are the policy implications of what you've discovered, Jeff, and what you've discovered, Father Greg, and what you've discovered, Olive? What are the public policy implications for that? What are the financing implications in terms of funding? What are the integration implications? What are the accountability implications in terms of are you funding projects or are you funding outcomes? So it raises up all these questions. And so we were actually part of a group to help Jeff and Harlem Children's Zone actually fund and develop what are the public policy structural implications for what he's done. And that has to do a lot with sort of de-siloing barriers, integration, and again, focusing on outcomes that supersede the silos, right? So if you want to have a vision of kids being healthy, safe, and ready to learn, you got to do the schools and the police department and the recreation department and the planning department. And I'm sorry, guys. It's Mark Willie Thomas. So it is a tricky business. However, I have to say to you that what we've learned, probably the newest batch of grantees we've been funding in the last 5 years, and this is before we heard Barack Obama, have been community organizers. One of our best grantees has been PICO, Pacific Institute for Community Organizing, a faith-based, very grassroots organization. They were concerned about healthcare issues. In terms of children's health coverage and health reform, they are producing armies of people that are descending upon Sacramento, the legislators' offices, and now even national in Congress. Okay? And so it's not that we have to get really, really intellectually brilliant about the question that both you and Bob have asked. We just need these legislators to do the right thing, right? and make sure that we have policies that are smarter about using public dollars based on what we're learning on the ground. And the best way to do that, again, is the idea, the data, the policy advocacy part, the pressure, or let the officials do the right thing, and then sort of what's the political strategy to sustain it. So I probably didn't answer your question very well, but it's because we haven't found a real good holy grail answer to either of those. And it's just a challenge for the sector. Last question?
Hi, I'm David Sloan. I'm both a faculty member here, and I work with the Community Health Council, who has generously received money. And one of the things that strikes me as you go through the presentation is I wonder how you are going to measure success. So you have success in the individual community where you're putting money,
Right.
and then you have success in the sense of what policy changes are made.
That's right.
But as you suggest from Dr. King, the arc is a very long one.
Yeah.
How do you set up interim steps that say to you, this is working, we need to think about this again,
Yeah.
we need to do something different?
Yeah, that was the operative question from our board. And so we now have generated a list of 240 metrics. It's too many, but we got to kind of boil that down. But the reason for that is because in the early years of community change initiatives, you're going to have more successful outcomes on process than on reducing childhood obesity rates, right? I mean, those rates are going to come down later. So you've got a strategy which says, okay, how do we break down the barriers? How do we identify the leaders? How do we identify the right organizations? How do we metric out, which is why we turn to some of the community organizing organizations to say, well, how do you know when you're being successful? Okay? Is the number of people that show up at a meeting? Is it the number of phone calls with legislators? Is it the emails? How does this work? So we're in the process of getting on a fast learning curve on that. One of the things I'm doing is I've hired someone who really understands something about Sacramento and policy. I'm looking at creating a position that brings community organizing to the foundation. How does this work? How do you know? So those will be, I think the front end of this initiative will be loaded with those kinds of metrics. We have time for planning because the economy and things are so bad right now that we just want to go quietly. So we'll have time to do that. But it's a very different model than where we've come from, where we kind of passively waited over the transom for an idea to come in and then maybe we had an objective based on a proposal. We now have a flag on the hill that's got clear outcomes and measurables, and now we've got to figure out sort of what the metrics are in between now and then. I'll take that as the last question, Jack. I just want to ask a favor, which is to those of you at this terrific institution. This will take a heavy lift during a difficult time. We expect to bring in and want partners. I expect and hope that USC will be a partner with us, at least in these LA neighborhoods that we've described, Boyle Heights and South LA. And so I see Manuel Pastor is here in the School of Religion with Chip Murray. We've been doing work with folks there. Mike Cusino, we work there. Jim Ferris has done some work, so we've got some partnerships with USC. But I would love to see us, and here's the opportunity. I just want to leave you with this nugget, Jack. Even with the doom and gloom, this Congress is about to pass a stimulus package that's got something on the order of $800 billion in it. Some portion of it will go towards distressed and low-income communities. Yeah, they're cutting back at the state, they're cutting back at the city, they're cutting back everywhere else. But what is our opportunity in the context of those new dollars that are going to be coming to Los Angeles and our region to use those dollars not just to create jobs, but to usher in a down payment for an opportunity agenda for this region? Okay? And we're willing to be part of that discussion with our resources, at least on the health side. But they're talking about community makeover grants, they're talking about promises neighborhoods, green jobs. That's the kind of things we need to have integrated into a shared vision for Los Angeles. And we've got one oar in this many-oared boat. Our oar is going to be in the water, and we'd like yours in it as well. Thanks.
thank you for a really significant and important talk. I also want to thank all of you for a very stimulating discussion throughout the day. And I want to acknowledge again, all the former deans and the Maritime faculty are here. And I want to convey a very special and heartfelt thanks to all the current SBPD faculty and staff. I am very proud of our school. I am very proud of our students. I am very proud of our legacy. Thank you all for coming today, and thank you for being an important part of the SPPD community now and in the future. Thank you very much.